Hi, good evening. Welcome to another episode of Your Health Matter OC. This is Dr. Clayton Chow with Dr. CK. We are the co-hosts for this talk show every other Tuesday at 6 o'clock. And remember, if you have any question during the show or prior to the show, you can send an email to yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. The topic for our conversation today is about women's mental health because May is the Mental Health Month, and we have two experts here with us, Dr. Ronnie Kelly, who happens to be our Chief of Mental Health and Recovery here for Orange County, and Dr. Patty DeMarco. She's the Medical Director as well as the Deputy Health Officer for Mental Health here in Orange County. But before we go to our special guests, our experts, let's go to Dr. CK for an update on COVID. Dr. CK?
Yes, thank you. So as many of you probably know, our numbers are rising. Our case rate per 100,000 is now 10, but we do know that that does not reflect the actual case rate, as many people are likely testing positive at home with COVID test. So if you have symptoms, please get tested with an FDA-authorized antigen kit or a PCR kit. Also, we still have people who are hospitalized. 89 are now hospitalized with COVID and 15 are in the ICU. That has been remaining stable. So the good news is even though cases are rising, we are not yet seeing hospitalizations go up, but we do realize that hospitalizations tend to be a lagging indicator of what's really going on. So really want everybody to protect themselves, get vaccinated, get boosted if you're eligible, wear your mask, especially indoors, or when you're in close proximity to others. The FDA just recently also announced that they are increasing or expanding the eligibility for the booster to those aged 5 to 11, as long as it's been at least 5 months since their last, since completing the primary series. But we do all have to wait for CDC and the Western States Scientific Review Work Group to endorse that, and hopefully we'll get a message in the upcoming days.
Yeah, so as usual, right, for people who are eligible for the vaccine, please get vaccinated.
Yes.
And also, depends on your own risk, do the other public health measure, right? Wear a mask when you are in a crowd, indoor especially, and you don't know people, you don't know their vaccine status. And if you yourself high risk or you live with somebody who's high risk, please wear a mask.
Right. So, and then also remember, if you get COVID, please notify your primary care provider or a provider or seek assistance because there's many different therapeutics that are now available and they're more widely accessible than they have been in the past.
Talk about mental health. I know you wanted to share a tragedy over the weekend.
Yes.
Do you want to talk about it?
Yeah, so unfortunately in Laguna Woods, I believe, we lost an amazing family physician, and I didn't realize I was going to get teary on this, but he's a family physician I actually personally met, and he was wonderful. Even when I met him, he was so engaged in the community, and he was a mentor to many students, medical students, nurses, nurse practitioners, PAs. He was very, he led in the affiliate groups for Providence, and he's part of the South Coast Medical Group. So our heart really goes out to the family, the congregation that lost such a hero. And, you know, this is such an awful time. It was an act of hate. And unfortunately, it's Asian and American Pacific Islander Recognition Month, too, Awareness Month. And this is so sad that we lost such a wonderful member of the community.
So for us, we lost a colleague who really is a caring individual. I've heard so much good thing about him. So our hearts go out to his family, to his friend and his co-workers, his employees.
Right.
Our hearts also go out to those who were injured, and hopefully they will be on a speedy recovery. These are all seniors. So thank you for those who was a part of the congregation that swiftly put the situation under control and have saved many lives. Yes. So thank you so much for your heroic action. But let us go to Dr. Ronnie Kelly. I know you've dealt with a mass shooting incident before with your previous job. What advice do you have for our community, Dr. Kelly?
Thank you, Dr. Chow. Unfortunately, I do have experience working with our San Bernardino County December 2nd terrorist attack and then the subsequent Las Vegas shooting. So things to remember are that oftentimes we in community really grapple trying to make sense with of what happened. And it's important to know that these are senseless acts. What research shows us is that when there are these types of mass casualties, these types of events, that communities do one of two things. They either break apart or they come together. And I will say for Laguna Woods, the community already came together during the disposition of the event. So that's a great thing. Really important though for people's mental health, since it's May being Mental Health Awareness Month, is to reduce our intake of media, aside from this show. That means that don't watch TV incessantly. Don't listen to the radio incessantly, especially about shootings. We had the Buffalo shooting. We had some additional ones, I think, in Wisconsin. So don't do that. Our brains can't take that kind of constant exposure to trauma. And talk about what you're experiencing. Many of us have histories of trauma, and when something like this happens, it happens on top of what we already are living with. So it exacerbates, makes worse the symptoms we already might be dealing with. So making sure that we talk to folks. If you are sad, give yourself a little bit of grace. If you're finding yourself to be more irritable than normal, give yourself some grace. Have grace with each other, because these are very difficult times. Also, if you have a family member or a friend who says maybe you need to see somebody, go see somebody. That means your family physician. You can turn over your insurance card on the back, and there's a mental health resource number that you can call. You can call OC Links here. If that's a resource that we have, it's available for you. So there are a lot of things we can do. It's important to know that grieving on a community level is a process. The only way to get through it is to go through it, and it's going to take however long it takes.
And I know in our community, through the support of our mental health and recovery department, we have a contract with NAMI, Orange County, to create a one line, which is 24/7, and anybody could call if you need to talk to someone. And that number is 877-910-9276. Again, the number for the NAMI warm line is appearing on your screen right now. So I would encourage you to call if you want to talk to somebody. But as she talked about earlier, Dr. Ronnie Kelly talked about earlier, that if you have private insurance, contact your health insurance. If you need to see someone, a therapist, for a longer session, right? Most employer offer employee assistant program that would give you free counseling session, a few free counseling sessions, and you can do that too. For individuals who don't have insurance, or if you have Medi-Cal as your insurance or Medicare, and you want mental health resources, or you want to talk to a counselor who could guide you to what kind of counselor you need to talk to, a therapist, what have you, you can call the OC Links number, 855-625-4657, and it's up here on the screen right now. So I would encourage you to do that, okay? Dr. DeMarco, Dr. Ronnie talked about trauma, and my fear has always been, how would this kind of event affect the young brain, the young children, right? And so this last few years, we've been talking so much, and there has been a push in the community to talk about ACE, the adverse childhood events in a person, and trying to screen people for that. Can you talk briefly about ACE, Dr. DeMarco?
Yeah, definitely. So we have to understand that childhood, the brain is developing. All the neurons, all the cells are developing very fast, and they're forming connections with each other. So even if the child has a family history, what happens around the environment determines whether those conditions that are familiar will express themselves or not. And puberty specifically is a time at risk, because there are profound hormonal fluctuations that happen, and now earlier and earlier for girls, they're getting their puberty, they're hitting puberty sooner. This is a global phenomenon. We know that 80% is genetic, 20% is environment, is what we're eating, what we're exposed to. And the sooner they hit puberty, the higher the chances of having mental health symptoms in adolescence. That is well studied. And so when you add to that the pubertal transition, the peer pressure, the academic pressure, the parental pressure, the violence that we're seeing, social media, screen time, it really creates a perfect environment for that predisposition to express themselves. And so adverse childhood events can alter the course of mental health conditions that are already sort of, the child might be predisposed, but if you put them in the right environment, they may not express it. But if you put them in a traumatic, hostile environment or something they're watching, because we can, like Dr. Kelly said, even if we're watching violence, that has a profound effect.
So isn't it though, even though we want to screen people, young people, using the age screening tool, even though children are resilient, but we really have to pay attention to that, because not only people with a higher age score develop mental illness, but also other chronic health conditions like diabetes and high blood pressure. Isn't that so? I thought the researcher has proven that, right?
Exactly. And I think, so basically, a child exposed to multiple social determinants and traumatic events will have higher cortisol levels throughout their upbringing, and that, along with that psychosocial factors, will determine the degree to which they will have later childhood mental health conditions. So it really is. Now there is a field of research looking into epigenetics. It's whatever happens around the genetics. So we might carry a genetic code from our parents or our grandparents, and those genetics may express themselves or not, depending on what happens around the genetics. So if your diet is poor or full in, processed foods, if you're in a traumatic environment where there's domestic violence, where there's shootings, where you're watching too much social media, then those genetics express themselves. So it is a time of early intervention too. You can alter the course of mental illness.
I'm always very curious, because we do know that when you compare boys and girls, male and female, men and women, biologically we are different, and some of those differences put women at risk for a higher percentage of certain mental illness, like depression, anxiety. But more than that, because of what's happening in society, domestic violence, violence towards women, young girl, poverty, right, sexism, etc., is also putting women at a more risk in developmental illness. So you kind of alluded a little bit to the younger age, and you talk about the hormonal changes that could predispose a young girl with mood changes and come with the various anxiety and depression. What about risk for substance use disorder, for addiction?
So I would say the same thing. If you're thinking about genetic predisposition to addiction, if that's the illness your family has, which my family has, and then the environment around you is such that the gene is turned on, right? So in my family, my sister was abducted when she was 8. And from that point on, when we got her back, we did get her back very quickly, but we believe she had been traumatized during that time, certainly. And that probably turned on that genetic predisposition for addiction, because immediately she started drinking, and she was 8. So what we do see is that trauma impacts females a little bit differently, and that would really be because of the social roles that we hold. So even though I think physiologically females are more resilient because we have 2 X chromosomes, right? So if something goes wrong with one, we have the other, unlike males. But our social roles place us at risk. And even the way we look at how women enter into addiction, smaller amounts of drugs are what are impacting women rather than higher levels. That part of it is hormonal. and the way we have more fat cells, how that impacts where drugs stay or, are metabolized in our bodies. And so all of that is really important, but women also quickly, they start slower, but then can quickly become addicted to a substance. And like many things in our world, our system for recovery from addiction is set up for a male. And so even I have a daughter who is in recovery from an opioid use disorder. Heroin's her drug of choice, was her drug of choice. And when we got her into treatment as a young woman, age 18, everyone there were men in their 50s. That's not helpful for her because it's more triggering of her traumatic experiences in the past. And even when we found female-specific treatment, which substance use disorder treatment should be gender-specific, the women were older. So an 18-year-old woman and a 50-year-old woman are very different socially, right? And hormonally. So the treatments were very different. So I think that's a really good point that you're making, is that gender is really something that we have to take into consideration when we're trying to treat a mental health issue or an addiction.
Yeah. So being this is a mental health month, we are going to share a handful of videos tonight throughout our 1 hour together. I'm excited to share this video because they've been created by some of the local Orange County high school kids who created this video as part of the Directing Change California Annual Film Challenge. Directing Change is a statewide effort to prevent suicide, reduce stigma and discrimination related to mental illness, and to promote the mental health and wellness of students. And some of the video was created by really intelligent and creative young women. And let's take a look at the first one. This video was created by Katie and Devon from El Dorado High School. Let's watch.
The pressures of teen life can often bring us down. We feel so busy with all of our responsibilities that we sometimes forget to focus on ourselves and our mental health. Mental health is not something that should be taken lightly. It is just as important as our physical health, if not more important. Life can sometimes feel like it's going 100 miles per hour and we can't keep up. Stay connected with your friends. You never know when they are going to need you the most. Kind words can go a long way. Be kind to everyone.
Hello, welcome back to Your Health Matter OC. Tonight we are talking to two experts on the topic of women and mental health. Earlier we were just talking about addictions and mental health in young children and how trauma affects and shape the ways someone express their feeling, and unfortunately, if not dealt with, could lead to mental illness and chronic health condition. So CK, from a primary care physician perspective, how do you convince your colleague that it is really important to screen children and family for this type of trauma in terms of their life history, right?
I think in terms of colleagues, I think we already see it, right? We see that the people who have a lot of traumas in their history are predisposed to depression, anxiety, also diabetes, obesity, and many other things. And so it's really important for us always to be preventive. And then we also see the other side where people end up in the hospital. And of course, we always want to prevent that. So it's easy to make that a priority. I think the challenge, though, is when someone really is in a mental crisis and it's beyond my ability, because I'm a primary care provider, it's finding the resources to get them to a specialist who can really manage the treatment that they really need. Because there's many different medications, many different therapies that they can start with. But I think there's always been a shortage almost of specialists who can really handle the complexity of the challenges.
Thank you. I think let us move a bit on the lifespan a little bit. Yep. I've always wondered, gosh, it must be difficult to provide primary care for young women, young girls specifically, especially girls who have trouble with their menstrual cycle? And how would a primary care physician or gynecologist connect with a psychiatrist who specializes in women's mental health, right? I know, Dr. DeMarco Patty, you are one of the very few formally trained psychiatrists in the area of women's health here in Southern California. I think there's a handful of you. I know I was one of the handful of psychiatrists in Southern California who treat women, but I was not trained through a fellowship like you did. I just learned through experience and was willing to see difficult cases. So can you talk a bit about premenstrual syndrome versus premenstrual dysphoric disorder? What's the difference, and what should a parent or parents look out for in young women?
Yeah, so this is such an important area and often missed and misdiagnosed and confused with other things. But the first thing that we need to remember is that PMS, or premenstrual syndrome, is extremely common. Up to 80% of women are going to feel uncomfortable before their menstrual cycles. That is cramps, bloating, fluid retention, some irritability. But most of them are going to be able to function just fine. About 8 to 10%, and some studies suggest 15%, will develop a more severe mood change that coincides with what we call the luteal phase of the menstrual cycle. That is when estrogen is down. So I'm going to take a second to explain the connection here. Estrogen is our sort of quintessential reproductive hormone, along with progesterone, and is intimately related to serotonin, which is one of our happy chemicals, one of 3 that we study very much, regulates mood. Estrogen regulates serotonin. Whenever estrogen is down, serotonin sort of goes down, or the functioning through the receptors goes down. So 2 weeks before menstrual cycle, estrogen comes down, and some women, we don't know why, are particularly prone to having more profound mood changes, irritability, agitation, depression, those 2 weeks, and so much that it impairs functioning. So we call that PMDD, or premenstrual dysphoric disorder. Very common. And the problem is that it often gets confused with other cyclical conditions like bipolar disorder. I always tell patients, not everything that swings is bipolar disorder. In fact, bipolar is only 1%. So it's common, but not all that common. So a lot of times they get misdiagnosed. They put on treatments that they might not necessarily need. And early recognition, especially in adolescence, is important because education goes a long way, and prevention goes a long way. And if exercise, diet, and there's certain things like calcium, you would have to talk to your primary care, of course, for that, but that could work. If that fails, there is more treatment options and therapies as well, like psychotherapies that you could do to cope and anticipate those symptoms a little bit better, and advocate for yourself as well. And so that we see every time, as you see where I'm going in the perinatal period and in the perimenopausal. I know we'll talk about that later, but you'll see how.
Let's go there now. Because I imagine that the mood changes could affect the ability for women to be able to get pregnant, right?
Right, and so we do know that depression and anxiety lowers fertility rates. In fact, a lot of women who struggle with infertility are reticent to seek help because they say, well, if I get treatment, God forbid a medication, then it will impact my fertility. And in fact, treating the depression and the anxiety will have a better fertility outcome. But in pregnancy, what happens is we think as a society that pregnancy is a protective state. Having a baby will make it all better, and somehow it will meet the quintessential, destiny of a woman. And what happens is that 20%, up to 20% of women will have prominent mood symptoms. We call that perinatal mood and anxiety disorder. We do not use the term postpartum depression so much anymore. We still use it in research settings. but not so much because it's confusing. Not all depression in that period is postpartum. Not all postpartum conditions are depressions. So perinatal mood and anxiety disorders is more encompassing. And up to 20%, 1 in 5 women in California today have a perinatal mood and anxiety disorder. And we tend to see this population as, well, it's okay, wait until they're done with pregnancy, we'll do something later. But untreated mental health conditions in pregnancy have and carry a higher rates of preeclampsia, prematurity, higher rates of emergency C-sections, babies that are born smaller than their gestational age, we call that SGA, babies who have lower well-being scores at birth, we call that APGAR scores. And we also know that neurodevelopmentally, these children, because of the epigenetics that we talked about, changes in the mom's cortisol levels will affect the in utero environment and provide the perfect environment for those genes to express themselves. Sort of saying to the baby, prepare yourself for a hostile environment, so now baby will have a more predisposition for later childhood depression and anxiety. So it's not okay to not treat. So, and then, we can talk more about how,
but
what we
I
do.
know, because majority of psychiatrists don't get specialized training in this, right? So it's very difficult. And of course, all medication, including over-the-counter medication, have side effects, right? And so when you talk about side effects and you talk about the fetus, people get very, very nervous, So for an addicted mother, what is the issue?
Yeah, so there's a lot of issues with an addicted mother. Remember that addiction is, in parts of it, a very social disease. But for women, the impact of depression and loneliness is really high. And so you have a woman who gets pregnant. I'll speak again about my daughter, who found out she was pregnant while she was using heroin. And so that's a place where, because women are more susceptible to cravings, the disease expresses itself in a different manner in their brains than in a male brain. That getting, and the social role, right? So the pressure of, I have a baby, can I focus on recovery so that I can attend to the baby or not? So for my daughter, and being addicted to heroin, she was participated in treatment and was put on methadone. That was her. Buprenorphine is another substance that we could utilize as well, but she was on methadone, which makes sure that she is not going to have any impacts to her pregnancy, because if a woman just stops cold turkey during certain parts of her pregnancy, that's an increased risk of miscarriage. So she was in treatment, working with other women who were also pregnant, getting some skills about how you parent, and attending to her addiction. So that when she delivered her baby did have neonatal abstinence syndrome, or NAS, and that required the thing that the hospital was very insistent on was that she breastfeed the baby immediately, because she had methadone in her breast milk, which would help reduce the symptoms in baby. And so my grandson was in the intensive care unit for about 2 days. And then after that, he was monitored for his symptoms, and she still fed him. And then she was able to, go home with him, and he's doing really well. And she is still on methadone. But it's that point now, because now she's a mom who is a woman who also has anxiety disorder and depression, and she needs to stay medicated, but she also, for her heroin addiction, but she also has to do all the things that new moms have to do, which is a lot. So really important for women who are in this space that we provide perinatal services. So those are substance use disorder services for pregnant and parenting women. We offer those here with the county. So a woman can go into treatment. She can take her children with her up to age 10, so that they all as a family unit get care. What we know is that for the majority of women who are afraid to seek treatment, the reason they don't seek treatment is they don't want to lose their kids.
Yeah, that's so anxiety provoking for everybody. So we're going to take another brief minute to watch another of their talented local youth videos. This video is called The Anxious Mind, and it was created by Alana, Julia, and Victoria from Rosary Academy. Let's watch this next video.
We all have voices in the back of our head.
Do I have a test in my next class? Does my outfit look okay? Am I smart enough? Were those girls just talking about me? Do my friends still like me? Voices that make us second guess ourselves and tell us we can't do it.
Remember your lines. Don't mess up. You've only got one chance.
Is watching you.
We try not to listen to these thoughts, but sometimes they simply won't go away.
Don't stop smiling. You will ruin the whole routine. Watch the timing. Don't let her fall.
But you are not alone.
There are people who love you,
who will support you,
and people who will cheer you on.
Don't let anxiety hold you down.
Let your loved ones lift you up.
Anxiety is more intense and longer lasting than your everyday stress. Anxiety makes it 10 times more difficult to control our worries and ability to concentrate. If you, a friend, or loved one may be experiencing severe anxiety, talk to someone you trust. For example, your school counselor, a parent, a family member, or even a friend. And remember, you are never alone.
Thank you. Welcome back. You're watching Your Health Matters OC. Tonight we're talking about women and mental health. CK, earlier we were just talking about perinatal. When I was in training, I was trained that every pregnancy should be considered high risk, right? Because of all of this issue with anxiety, depression, addiction, and what have you. What is a family doc to do, a gynecologist to do when you get into cases like that?
I think, so perinatal health care for me, when I see a patient who's pregnant, well, it's a wonderful time. In my mind as a primary care provider, is I'm always thinking about all these other factors, these social factors that affect the pregnancy. And as we just heard, you need to discover if there's depression, anxiety, or some sort of mood disorder, because there are treatments available and there are things that we can do to manage. And also in the pregnant period, the woman is also at high risk of domestic violence. And so it's really important to address that during all the visits. I know we listen to the baby's heartbeat, but really I'm keying in, how are you doing at work? How are you doing at home? How's your support group? And, we're supposed to be asking questions that kind of indicate to us that there's too much stress on the mother. And as Dr. DeMarco had mentioned, if we find that they do have depression, anxiety, we need to offer therapy, because even the American Academy of Pediatrics strongly recommends that if there is depression, anxiety, you have to address it, because it will affect the newborn. There are studies showing, yes, increased risk for depression, anxiety for that child, as well as obesity and diabetes at an early age. So just as we were talking about epigenetics, it does turn on some genes to make them at higher risk. Also, after the pregnancy, we all think of, once you deliver, it's going to be a beautiful thing, but there's so many other stressors. The mother is now filling a different role that they're new to. They're not getting any sleep. They may or may not be getting the support they need from their family. There's a lot of people telling you what to do, and you want to do it your way. And so there's also very high risk for perinatal depression or mood disorder, now that we call it. And I actually was one of those people who actually suffered from that after both pregnancies. And as a physician, I didn't want to seek care. I guess I had that stigma. I didn't want to seek care because maybe it said something to my residency program and my colleagues that I was too weak to be able to handle the pregnancy and the delivery. And unfortunately, that's not the right way to think. But, I fell into that trap. But eventually, when certain things start happening in your brain, you start hearing some things that maybe you shouldn't be, I finally sought care, and I'm so glad I did, because there are treatments. Again, it takes more than just treatment. It takes medication, it takes therapy to try to get out of that negative talk so that you can enjoy your baby, so you can enjoy your family. So exercise, very important. Luckily, with my second pregnancy, after learning from the first one, I immediately told my OB, I've had this and I know I might have this again. And so I actually proactively sought for friends to help me out with exercise, and proactively immediately sought therapy. And exercise really got me through that year. And I talked to my patients about that to say, hey, there's so many different things we can do to make this a joyful time, but we have to be honest with where you are now and address any of the challenges you're facing.
So thank you for mentioning that. I just want to take this opportunity and share that Recently, there was a statistic shown that throughout this 2 years of the pandemic lockdown, the incident of intimate partner violence have increased in a lot of countries, in some countries up to 300%. So for the women who's watching, if you're in a situation of intimate partner violence, please call for help at the number that we gave you earlier, OC links and the NAMI Warm Line. Call, and people will be there to help you. So, Patty, Dr. DeMarco, talk a bit about the perinatal depression versus psychosis. Thank you, CK, for sharing that. Personal story, but tell us about the differences, because I think there's some confusion.
Yeah, there's a lot of confusion, and in fact what has happened is that over time the terms have gotten mixed, and for a variety of reasons there's been a lot of misinformation in the media too, and it alienates women from seeking care, because the first thing they think is what has been in the media for the case of Andrea Yates, right? It's 5 children. She was in the state of psychosis, and she harmed them, and she remembers none of it. And so postpartum psychosis is actually very rare, but very serious. And it is a manifestation of undiagnosed bipolar spectrum. It's not schizophrenia. It's typically a first-time bipolar episode that is triggered in the setting of a profound hormonal fluctuation very early in the postpartum period, within the first 4 weeks. And the risk of harming themselves is 5% of suicide in postpartum psychosis patients, and about 4% of unintentionally harming the baby as well. So that is very scary. However, very different from postpartum depression. Postpartum depression or perinatal mood and anxiety disorders are 20%. The risk of harming the baby is extremely low. And one thing that we need to remember is that postpartum depression coexists always, very common, with unwanted intrusive thoughts. Intrusive thoughts are unwanted experiences of sort of like having an image in our brain that is scary, it's uncomfortable, and it might have to do with a fear of contamination, a fear of the infant getting harmed. And women are often reluctant to talking about those thoughts, thinking that they're going to be taken away, they're going to be hospitalized, but they're actually very common. And what I teach the hidden mental health system, which is primary care, OBGYN, and pediatricians, is how to differentiate intrusive thoughts from postpartum psychosis. In intrusive thoughts, the woman is very uncomfortable, usually crying and telling you, I'm having these thoughts, I'm very uncomfortable. But she is able to function. There are no other symptoms of psychosis. The behavior is not disorganized. They're sleeping okay. They're not having what we call hallucinations, things like that. The postpartum psychosis patient, again, very rare, very serious, will not be bothered by those thoughts, does not appear to be bothered, and also might have other things like hallucinations, paranoia. The behavior is disorganized, completely out of character, and that's the ones that is a psychiatric emergency. That is true, and it waxes and wanes. What does that mean? That it doesn't just stay for several weeks, it comes and goes. So 1 minute, the woman might be acting like themselves. That's when they typically get discharged from care and they go home, and then a minute later, they're having delusions again. They have no touch with reality, have no recollection of the event, of what they were thinking at the time, and that's when they can harm themselves or harm their baby. Very different conditions, but the confusion has alienated people from seeking care. Most commonly, what you're going to be seeing in the hidden mental health system is perinatal mood and anxiety disorders and these uncomfortable, intrusive thoughts which do not carry a risk of harm.
But the good thing is, I think in California, at least a few years ago, there's state law that require hospitals that deliver baby to screen the mother for mental health condition. Is that correct?
Yes.
How do you think the hospital have been doing?
So in 2017, a comprehensive maternal mental health bill package was passed. with 4 pieces of legislation. One of them included universal screening at the hospital and also training at the hospital level to all providers who are involved in perinatal care to know and recognize and screen. I think there was a report, a 2-year follow-up report released, and there's still work to do in terms of universal screening. But more importantly, Dr. Chow, there's more work to do in building a system of care. Because screening, we can screen all we want, but if we do not have a continuum of infrastructure to capture these women so they can get treated and we can meet them where they are, home visitation programs, intensive outpatient, partial hospitalization, mother-baby units. We don't have a single mother-baby unit in California or on the West Coast. These are units where they can get the mental health that they need in a crisis, and baby can be in the premises with supported breastfeeding support, their storage for milk and all that. We don't have that. So if we don't have the infrastructure, it might be difficult. But there are solid strides with more legislation that has been passed and investments in this area to look more closely into building a system of care that together with the universal screening will help mothers navigate the system a little bit better.
Thank you so much for that information. Now let us move up in age. There's a question from Kate. It's going to take us there. I believe that I may be perimenopausal and wanted to know if that could affect my mental health. I am experiencing these very high highs and very low lows, and I have never been this emotional. What can I do to find some balance?
Yeah, so this is also very common. So you remember at the beginning of our talk, we talked about that relationship between estrogen, right? So as anything in mental health, biological, psychological, and social reasons that make together mental health conditions, 20% of women in the menopausal transition will experience depression and or anxiety. And that's a time of not only hormonal fluctuations, Dr. Chow, but also that's the time of empty nesting. That's the time of aging parents. So now the mom is going from a maternal role to a caregiver role. That is a time where there are career decisions. Do I stay where I'm at and retire here? Do I change? There are marital dynamics change. So it's a combination, again, another time at risk. So we talked about puberty, perimenstrual, perinatal, and now perimenopausal, all times in which there are biological factors together with psychosocial factors. And not only is there an increased risk for a depression and anxiety, but cognition as well. So we know that estrogen is neuroprotective, it's protective of our brain in a certain degree. When that drops, women up to 80% will report subjective memory loss. About 5 to 10% will go on to test positively for mild cognitive impairment. What does that mean? You can still function fine, but on testing, specific neuropsychological testing, I could see that is not normal. And then having that can increase the risk of further memory loss. So it's important to have a conversation with your physician about what your options are early on, especially in the what we call menopausal transition, which is about 5 to 8 years before the last period, right? So before the last menses. Those 5 to 8 years before, there's a window of time where a lot can be done, not only in terms of medication and potential hormonal replacement for people who are candidates of that. That's a risk-benefit discussion with your physician. But exercise and the proper antioxidant-filled diet, there is data on that and nutritional aspects as well that could prevent some of those memory conditions. And of course, seeking help early, strengthening your support system, therapy. There's a lot of room for individual psychotherapy as well.
But you talk about changes, CK, about the relationship for mothers, right? There have to be changes in relationship with the husband, the father. And then now, older woman with changes in life cycle. What is that risk for addiction, Ronnie?
It is pretty high. We are seeing an increase in elder populations, in particular women, and that might have been that it wasn't really expressed previously until a spouse dies, until there's a traumatic event. And then the coping skill, based with the genetic predisposition, really exacerbates the drug use. So we are seeing women, especially with alcohol, they are never asked when they go to their physician, how much are you drinking? Because it's an older woman. So we have a lot of stigma and shame, especially for women and the roles we hold in our lives. So even to talk about what Dr. DeMarco and Dr. CK have said, a woman who's experiencing these things, these feelings, these thoughts during supposedly the happiest moment of her life, now she's become a mother, it is very shameful, in particular in many cultures represented here, for us not to feel excited about being a mother. In the same way, women who have these roles now as being grandparents and great-grandparents, and so they should be the ones who are sharing their wisdom with the population that's coming behind them and caregiving. They're stressed as well. And it is really very shameful from a generational perspective to talk about the fact that I drank 2 pints of vodka every night just so I can go to sleep. And it's shameful. People feel very ashamed to share that with their primary care physicians. That's why it's so important that our primary care physicians, our psychiatrists, any of our family practice docs ask the questions, that we do an ESPERT, that we do a screening, a brief intervention and referral to treatment, and that we don't exclude a woman because she's over 50.
Well, on top of that, pain medication, isn't that an additive to the whole problem, right? So before we wrap up tonight, last segment, we're going to view this final video. This talented duo of filmmakers, Samantha and Talia from El Dorado High School, created a video titled Alone. No matter how old you are, I think everyone can relate to the feeling of being alone. You're just talking about emptiness syndrome or a woman who've lost their husband. So let's watch the last video.
Depression isn't just sadness, it's loneliness, it's hopelessness, it's being numb. It's knowing something is wrong but not having the energy to care. It's walking with your head down because who would notice if you weren't there? It's swimming in a sea and never getting a breath of air. It's drowning in the weight and wondering how the pressure became so great but never reaching out until it's too late. It's the layers of anger and isolation and guilt that you can't control, but how do you reach out when the world seems built to swallow you whole? When you think it should be hidden away, but the truth is it shouldn't. Maybe you think people wouldn't understand or care about what you go through, but you aren't in this battle alone. People are supporting you and you don't have to fight it on your own. Your mental health matters, so reach out when you need it. For more information on how to take care of your mental health, visit eachmindmatters.org.
Thank you. Welcome back to Your Health Matter OCs. Tonight we're talking to our experts on the topic of women and mental health. There's a question from Elena. Here's her question. During COVID, I found solace in cooking and baking, and now my weight reflects it. I'm constantly struggling with my own reflection. It's a vicious cycle. How do I get out of my own head and move forward?
I can take that question. So, well, it sounds like a lot, we all found during COVID, during the times of isolation and uncertainty, I always comment about how uncomfortable uncertainty is, right? Different ways to cope. Some people like to watch, comedies. Some people like to bake. Some people like to color. Some people like to go out. But baking was very prevalent. And so a lot of people put on a significant weight. And it's not easy to, go back and think, okay, how do I get back to my routines? How do I get back to my structure? So what I tell people is to try to, number one, go back to the basic lifestyle changes of routine, even if it's just 8 minutes, 10 minutes. You don't have to set yourself a big goal of exercise, but 8 minutes of aerobic activity, and then you start building on that. When we tell ourselves, I'm going to exercise for an hour, that to me is unrealistic. I have 2 kids, I'm busy, I have a full-time job. I don't, but what if I tell myself I'm going to do 8 minutes, it's a lot more palatable. And then you add to that, obviously, small small changes to your diet. Now, if you are feeling sad every day, all day, and with lack of pleasure in your typical activities, hopeless, sense of despair, that might be signs of clinical depression. That's when I want you to seek help. When those feelings are so severe that are getting in the way with your relationships, your work, your academics, your parenting, at that point I want you to seek help and either call one of the numbers that we mentioned, talk to your primary care physician, but do not try to deal with it on your own because an untreated depressive episode could last a good 9 months on average, and during those 9 months, a lot can happen. Jobs are losses, relationships can be broken. There's a lot of consequences of not seeking help, so please do so if you feel like you're having those symptoms.
One of Elena's question that I didn't add, because I wanted us to address this, and the issue of isolations and really withdrawn at home because of the lockdown. And Elena said that she used to be quite active and was outdoorsy and not anymore. I think that has happened to a lot of folks. I know, and here's a confession, it's only this month that I felt comfortable going back into the gym to exercise, which I did before, right? And I continue to wear my mask inside the gym, and thankfully there's other people who are doing the same too, so I felt comfortable. I mean, I've been wearing my mask throughout the whole exercise routine in the gym. I'm sure we see a lot of that, right? Can you talk a bit about the mask issue with indoor? And I know I mentioned earlier, but how do you advise a youngster from a primary care physician in making this kind of decision, right?
Of wearing a mask indoors?
Yeah.
So again, this all depends on your risk and what your own personal risk is and the household members that are close to you. If you are high risk because someone is frail and elderly, or you yourself have conditions, or maybe you're not fully boosted, you may want to wear a mask. And I understand it's very hard, and there's different ways to exercise. So if you're not yet comfortable in the indoor setting with a gym that has good ventilation, consider just going for a walk. I actually recently started doing that, and I'm always thinking exercise means you're sweating, you're really out of breath, but really I think especially with the stress we're all handling, it's really important for you to give yourself grace. I love what you were saying earlier, Dr. Ronnie. I just recently I had back issues, and so I love running, but I can't do that, and so then I had to start with first meditating to give myself grace, and that's just 2 minutes, 3 minutes. I worked my way up to 5 minutes, 10 minutes, but you have to take one step at a time. And then also walking, walk 1 block, and then 2 blocks, and then 3, and just build it up. And you may realize that you like outdoors. I actually like outdoors now. I like seeing green. It makes me feel more calm. But yes, I love the gym too. But when you feel more comfortable and you're not as at risk because you yourself are not at risk, or people in your household are not at risk, yes, you should be able to we'll go inside without a mask, but just realize you still may be exposed and just distance yourself from others. I think it's so important for us to maintain social connections, and so for the inquiry, try to get back and connected with your friends, even if that's a phone call, a text, to just see how they're doing, and then maybe go on a walk for them. It's a great way to reconnect. We just need to make these baby steps back into what our normal lives used to be. We don't have to jump over there. We just have to make small baby steps to get there.
Good advice. Here's another question from another audience, Diana. I actually had COVID in March of 2020, and it was a severe case. Since then, I haven't been able to fully recover my focus and attention. My mind wanders. I get easily distracted, and sometimes I forget what I'm talking about in the middle of the conversation. Is this something that affects people? Does it affect women differently, and what can I do?
So we're still learning so much more about COVID and how it affects us.
We talk about long syndrome or long COVID syndrome.
And, in long COVID, well, in COVID in general, it affects our vessels and our brain cells. And so first, don't take it personal. Unfortunately, these are effects of COVID, and you should tell your primary care provider, your provider, that you're having these symptoms. Again, this is an emerging science. We're all learning about what to do, and hopefully your provider can get you connected with other specialists who are doing a lot of research in this field. But it all goes back to basics. Give yourself grace, do the calming things, meditation, and don't be so hard on yourself. Don't expect yourself to be who you were before, because things have changed a little bit. And again, it's not your fault. You could just blame it on the virus. And it may take time, but there is hope. There are some people who actually regain full function after months. We just don't know what that timeline is for everybody.
The important thing is you're not alone. Research has shown that about a quarter, right, of people who have COVID have had lung syndrome. So we are learning more, but from a basic cognition perspective, what is your advice? I know earlier you talked about menopausal, elderly, especially women, higher risk of memory problem, right? Mm-hmm. Mild cognitive impairments or actually dementia. I know a decade ago there's been research, and since then shown that particularly in women, the risk of dementia is probably twice men, and there's some correlation, pretty solid correlation between earlier untreated depression and anxiety, which could lead to dementia at older age. And I know we're seeing that in my family member, and I strongly believe in that. What would be advice for someone like this dealing with their cognitive impairment, whether it be from substance or from mental illness?
I would just say, first of all, aside from giving yourself grace, know that this is really important, I think, for everyone, especially those folks who are saying, you know what, I'm just going to get COVID and get it over with, and then I'll move on. These are the reasons we don't want people to try and get COVID, right? So mask up, keep your distance, get vaccinated, get boosted, all of those things. But I think another thing is that during COVID, because we've been isolated from each other, we did a lot of things like drinking at home. We couldn't replicate the bar or the place where we gather for social events, so we started drinking at home. And those are habits that we've continued. Drinking and the use of cannabis are going to further impact our brain. And as Dr. CK said, this virus does attack parts of our brain. We have to be really mindful that we have to preserve what we have now, and then again have grace with ourselves so that we take things one step at a time, knowing that even talking to someone else, like these ladies have done here, asking the questions, that way we don't feel like we're so alone.
Yeah. Advice?
So when you, from the beginning, the mechanism of the virus and how it enters, that we would be seeing some neuropsychiatric sequelae, which is essentially some brain being impacted, and yes, up to 30% we're seeing increase in depression, anxiety in patients who've had COVID. So you're definitely not alone there. What I would say, it's really important to get an evaluation to get some clarity about what that diagnosis is and what that treatment is going to be. I wouldn't try to deal with it alone. There is obviously lifestyle changes that you could do, but there's also a lot of value on getting, if there is clinically significant mental health conditions, depression, anxiety associated with these cognitive changes that you're experiencing, there is treatment for this. And again, that's a risk-benefit decision that you'll have with your primary care physician. But there is a value in treating early and treating properly, and in order to prevent complications from anxiety and depression that can come together with the memory conditions. And yes, more data is needed and emerging on how long it's going to last and what are the gender disparities between the prevalence of the symptoms. But we do know it's there, we know it's real, we know it's serious. And I would just get early intervention and try to talk to your primary care physician as soon as possible.
So, I mean, the bottom line is mental health is serious. It's affect the well-being of an individual, of the family, of the community. So we want to make sure that if you have questions, please seek help. If you have any crisis that you don't suffer alone, right? There's a whole network of resources out there for you. We gave you information to at least the NAMI warm line that you could talk to someone, 877-910-9276. And then if you need resources on mental health, you can contact our OC Links number is 855-625-4657. And then if you want information on mental health and addiction, go on to the county healthcare agency website, ochealthinfo.com. Again, is ochealthinfo.com. I want to thank our guests tonight, Dr. Ronnie Kelly and Dr. Patty DeMarco, for sharing so important information, particularly on the mental health condition and women, and how it affects the women life cycle and how it expresses differently than men. Next week on Tuesday, May 31st, in anticipation of the summertime, we're going to be talking about water safety as well as swimming and drown prevention. So I hope you will tune in and join us for our next important topic. But between now and then, if you have any question, please send an email to us, yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. Until then, thank you for tuning in. Please share the YouTube channel widely with your friend. We'll see you next time. Thank you.